So I'm a speech-language pathologist. I have a private practice down in Punta Gorda. I've been in Florida 30 years. And back in mid-1990s, I was working with more and more people with Parkinson's, and sort of around that time, my dad began to have symptoms of Parkinson's. He was up in Ohio. And I began to become even more invested in working with patients, and I realized that even after I saw someone in therapy for 30 days, that they would often look at me like, kind of like, well, now what, right? Because 30 days of therapy is pretty short-lived if you don't have something to do afterward. And so at the time, my office was located within a hospital that had a wellness center with an aerobics room, and I thought to myself, what if I created a class that was kind of designed like an aerobics class, but we focused on voice and posture and breathing. And so in 1999, voice aerobics was born, and that was that the class couples voice with movement. And in 2008, because people kept asking me for the exercises, we actually recorded a video of the class. I'm telling you that because we're going to use that part one, which is called breath work. It's only that's all right. Oh, there we are. But it remains kind of like my favorite part of the whole 57-minute class because for all the 20 years that I've been doing it, I always find it relaxing, mindful. I'm always sort of just focused on what my body is doing. And so I really invite you to have that same experience this afternoon. So one of the reasons I use the video lots of times when I'm doing a class for the first time is going to make it a little bit easier for you to follow along. I'm going to be right up here doing it with you, but you're going to see an older or newer, I don't know how to say it, was an older version of me. And it was recorded in 2008, so it's my younger sister, think of it that way, actually leading the class. But it may help you follow along. And I try not to then interrupt once we get going. And in fact, I may come onto the floor because I like to be near you, and I might just give you little hints if I see somebody doing something that could be done a little bit different, all right? So we're going to start with, again, focus on breathing, sort of like I did in that little 5 minutes. And you'll see a series of breaths that'll be through pursed lips, and then a shh, and then that little humming sound. And then we'll start adding some things into it. Do everything to the extent that your body will allow you. That means when we raise our arms up over our head, if you can only go this far, you go this far. If you're here with a spouse, and your spouse doesn't have Parkinson's and is used to coaching you at home, please don't coach them here. I'm the coach. So if you're a spouse, I invite you just to focus on what your body is doing, and your breathing, and your voice. All right, so let me see, anything else I want to say? I think that's it. And then if I have something I need to say, I'll ask Diane to just pause the video and interject a thought. Okay, so I think I'm going to come down here. So everybody sit up nice and straight, get ready, feet on the floor. Again, if you can sit with your back away from the chair, then already you're engaging your core, which will help support your posture. Your posture supports your breath supports your voice. We're always speaking on the breath. Ready? I'm ready. All right, everybody. So we're going to begin first by working on posture and breath, and then we'll add our voice. But our posture and breath always is a support for our voice. And the first thing we're going to do is just feel what it feels like to take good diaphragmatic breaths. And so you may even want to start with one hand on your abdomen, because you're going to feel your abdominal muscles relax when you take the breath in and contract when you let the breath out. And they really are the working muscles for respiration and for voice. Let them do the work. Keep your neck and shoulder muscles relaxed. We're going to take a breath in through your nose and mouth and exhale through rounded lips.
You're going to blow, 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 release the breath. And when you're at the end of the breath stream, your abdominal muscles should feel tight. You really want to round your lips. That's called pursed lip breathing. It's a real effective way to exercise. So you don't want to just half-heartedly do that. And you want to begin now, even with the breath work, to do what might feel like exaggerated facial movements, because we really want to counter one of the effects that Parkinson's can have, which can kind of rob you of some of that facial expression. All right, let's do another one. Take a deep breath in through your nose and mouth. Exhale through rounded lips. That's 2. The breath out is always about double the breath in, and the breath out is also the breath that we're going to speak on. So this time, as you exhale, you're going to exhale with a shh, like you were telling someone to be quiet. So you're going to actually be able to hear that breath stream. Take a deep breath in through your nose and mouth. Exhale with a and feel those abdominal muscles contract. One more time with a shh. Inhale through your nose and mouth. Exhale. Let those abs work. Tighten those waist muscles. And then one more time, and this time when you exhale, we're going to turn our voice on, but we're going to turn it on with a real nasal resonant sound. So we're just going to hum. Inhale, exhale with a hum. Feel some vibration up here in your face and in your nose. That's where we want your voice to be resonating. Great. We're going to continue to focus on the breath. We're going to continue to focus on posture. Check yours. Make sure that you're using your abs to help you sit up straight in the chair. And now we're going to add your arms. So we're going to inhale and exhale through pursed lips, but this time as we inhale, our arms are going to come up chest level and exhale to the side. Ready? Begin. Inhale up. Exhale to the side. Now you don't need to go any higher than your shoulders, but you're going to hold that stretch, breathe naturally, and gently release your arms to the side. Great. We're going to do one more. Arms come to the side. Inhale, arms come up chest level. Exhale to the side. Round those lips like you were given a kiss. And hold the stretch. You're look beautiful tonight, and release your arms. We're going to inhale with our right arm coming up over our head, and we're going to exhale with a shh. Inhale, your right arm comes up. Really stretch those muscles all the way down the length of your body. Exhale with a shh. And as you're exhaling, your abdominal muscles are supporting your breath. They will support your voice. We're going to inhale, and left arm's going to come up over your head. As you inhale, exhale with a big Great. And one last time, we're going to clasp our hands together. We're going to inhale, our arms are going to come up over our head. We're going to exhale just with a humming sound. Feel that resonant voice again. Inhale, up, big stretch. Exhale down. Good. Check your posture. And we're going to do some head rolls. We're going to start as we inhale and exhale through rounded lips. We're going to look over your right shoulder and hold that stretch. So inhale, exhale to the right. Great. Now breathe naturally, but hold that stretch. Look even a little further if you can, like you were backing out of the driveway, if you're still driving, pulling out of a parking spot. Now gently roll your head back across your chest. Hold it just for a few seconds down. Let those neck muscles in the back stretch. And then gently bring your head up. Great. We're going to do 2 more. The next time as you exhale, you're going to hear the airstream because you're going to exhale again. Look at shh. Inhale through your nose and mouth. Exhale to the right. Hold that stretch. Look a little further. Breathe naturally. Check your posture. Roll your head back down across your chest. Hold it for a second. Let those back of your neck muscles relax and stretch. And bring your head up to the middle. Nothing should ever hurt. Do everything to the extent that your body will allow you to. We're going to turn one more time to the right. This time we're going to just exhale with a humming sound. We're going to hear that resonant sound again. Inhale. Exhale. Feel the vibration of your voice on your lips. Hold that stretch. Look over your right shoulder, even a little further if you can. And then gently release the stretch. Bring your head back to the center. Let those neck muscles in the back relax. Come up to the center. And we're going to do 3 to the left. We're going to inhale, exhale through pursed lips as you look over your left shoulder. Inhale, exhale, round those lips like you were blowing a whistle. Breathe naturally, but look even a little further if you can, without straining, shouldn't hurt. And gently roll your head back down to the center. 2 more times. The next time we're going to exhale with a shh. Inhale, exhale, look a little further. Anybody coming? And just release the stretch. Release your head. Roll it back to the center. And one more time. I think one way to stay motivated about exercises as we do these exercises tonight, I'll try to remind you of something that you do every day in your life that uses these same movements. All right, one more time. We're going to inhale. As you exhale over your left shoulder, we're going to exhale with a hum. Your abdominal muscles are still supporting your breath. Your breath is supporting your voice. It should be resonating up in your lips and up in your face. Hold that stretch. Release the stretch. Release your head. Roll it back across your chest. Hold it just for a few seconds so those neck muscles in the back relax. And gently bring your head back up to the center. Great. We're going to do some shoulder elevations and we're going to release them. We're going to do 6 without voice, and then we'll add the voice, and when we add our voice, we're going to add some glides. So just raise your shoulders all the way to your ears, and exhale, push it down. And you might even just want to put your palms so that they're just pushing down into the ground. So you're just pushing that breath out, releasing any tension up here in your upper body. That's 1. Inhale up, exhale down. You look great tonight. Inhale up. Exhale down. That's 3. 3 more, then we'll add our voice. Inhale up. Exhale down. Feel those abs contract. 2 more. Inhale up, all the way to your ears. And then release all those neck and shoulder muscles down. And 1 more. Inhale up. Exhale down. Now we're going to add our voice. We're going to glide up to the highest note you can and then glide it back down using the vowel E. Ready? E. Push it down. E.
Smiling at the E.
Glide up. E. Push it down. E. 4 more. E. Push it down. E. Push it up. E. 2 more. E. Push it down. E. 1 more. E. Push it down. E. Vocal glides are a great voice exercise. They stretch the vocal cords, they shorten the vocal cords, they lift our voice box all are really important maneuvers for swallowing and for voice.
Can you pause that 1 second,
All right.
please?
We're going to do a few more vocal glides, and this.
So I just want to emphasize this point. I always tell my patients when they're done with therapy, at the very least, do your core exercises. And vocal glides are a really important core exercise because they stretch the vocal folds when you're gliding up, and they shorten the vocal folds. And they lift the larynx, which is a really important movement that has to happen when we swallow to help protect our airway. All right, thank you. I just wanted to make that point.
We're going to raise our arms to the front several times, and then we'll raise our arms to the side,
Again, blowing out that breath.
using our shoulder muscles to help
Don't
lift
need to
our
come
arms.
any
All
higher
right,
than
so
your shoulders.
let's do first just the arms. They're going to come up. Inhale, exhale down. We're going to raise up. Exhale
That breath
down.
out.
We're going to glide up with an O.
Guys,
You don't need to
stretch
come any
the
higher than
eye
your
out.
shoulder. Two more. Round those lips. One more. Four to the side.
Round your lips.
Three more. Reach for that high note.
You sound great.
One more. Let's stop there. If you might want to pause your tape at home and take a drink.
So again, vocal glides, something you can do every day, doesn't take a lot of time.
All right, and we're almost done with our warm-up. We're going to inhale, arms up over our head as we exhale. We're going to exhale with an ah. It doesn't have to be a real loud ah, but open your mouth, relax your jaw.
Remember, bring your
Remember,
arms
your
as
breath will
high as you
support your
possibly can.
voice. Inhale, up.
Inhale up.
Exhale. Great. So this time, as we inhale, arms will come up over our head. We're going to exhale with an ah. It doesn't have to be real loud, but relax your jaw, open your mouth. Remember, your breath will support your voice. Inhale, up. Exhale, down.
Open your mouth. This is where the sound comes out. You gotta be open.
We're going to inhale, right arm up over our head, that big lateral stretch again. We're going to exhale down with an E. Good. We're going to inhale, left arm's going to come up over our head. We're going to exhale down with an I.
Except with an I.
Arms are going to come up chest level with the stretch to the side. Inhale.
Inhale up.
Hold the stretch. And one last time, we're going to clasp our hands in the middle. We're going to inhale, stretch up high over our heads. Exhale down with an air. Inhale up. Release the breath. Release your voice. Great. Now
now that you're warmed up, are you ready to power up your voice? So we have, what, 5 more minutes? Okay, so let's take that 5 minutes and power up our voices a little bit, all right? So again, without hitting anybody in front of you or next to you, let's do a few punch-ups, all right? And we'll punch it out first, so it's 4 alternating movements. We'll punch it up, big stretch, alternating movements. And if you got room, we'll punch it to the side without hitting your neighbor. All right? And as we punch it up, we'll punch it up with a high. Ready? Go. High, 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 high to the front with a high, 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 high to the side. He. Go up. High, 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 high to the front. Ho, 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 ho. Shake out your arms. All right, so guys, with upright posture and an open mouth, I can't tell you how many people I saw here today whose mouths were barely open. This is the auditorium where the sound resonates. You've got to be open. So exaggerate those movements. So the guys are going to vocalize an ah, a loud ah, an energetic ah. They're going to hold it for 10 seconds while the ladies count 10 seconds in a loud and energetic voice. Ready, guys? Go. 10 seconds backward. You know, ladies, I'm warning you. You may be doing it a long time. Well, the guys count backwards 10 seconds from 10. Ready? Go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great. All right. So you remember this morning I said, it was this afternoon actually. It seems like this morning. A long hours. Right? It seems really long to you guys. So I said lots of times, patients will tell me that they run out of breath when they talk. And they probably aren't running out of breath, but maybe just muscles are stiff or they're not using their breath support real well. So I was kind of playing around with this little idea on the long drive up today. So we'll try it, all right? So we're going to do a tongue twister, but it's a familiar one. You all know it, trust me. But I'm going to break it into syllables, all right? So there happen to be 12 syllables in this tongue twister. So I'll say it first, and you'll all repeat with a loud and energetic voice, all right? So here we go. Peter. Peter. Piper. Piper. Picked up. Picked up. Peck of. Peck of. Pickled. Pickled. Peppers. Peppers. Great. All right. So I'm going to break it into 4 syllables now. I'll do it first. Ready? Loud and energetic voice. Peter Piper. Peter Piper. Picked up peck of. Picked up peck of. Pickle peppers. Pickle peppers. Now we're going to do it one more time, very slow, and just feel where you need to, we're going to say the whole thing, where you need to replenish your breath as you're saying it in a pretty slow rate. All right? So here we go. Together. Peter Piper picked up peck of pickled peppers. Well, that was nice. I saw your chest rising and falling every time you took that breath, all right? And 1 or 2 last times, let's do it really fast, all right? This is a tongue twister after all. Here we go. Peter Piper picked up peck of pickled peppers. I think you could go faster. Peter Piper picked up peck of pickled peppers. Even faster. Peter Piper picked up peck of pickled peppers. Even faster. Peter Piper picked up peck of pickled peppers. Now, does anybody know the answer to the question? What's the question? Yeah. Who knows the answer? Nobody. All right. time to go back into the other room. Thank you for joining me.
Thanks so much, Mary.